I'm about to show you something that might completely change how you measure your blood pressure at home. And when you hear mistake number one, the one almost everyone makes, you're going to realize something shocking. There's a very high chance the number you saw on your monitor this morning was wrong, not slightly off, not a few points, completely unreliable. And that mistake alone can add 20, sometimes 30 points to your reading, enough to get you prescribed medication you never needed. Or worse, enough to hide a dangerous spike that should have sent you to the hospital. As a cardiologist, I've seen both happen. I've seen patients rushed into emergency rooms in panic over fake numbers. And I've seen others ignore real danger because their monitor falsely reassured them. Both situations started the exact same way, with a simple home blood pressure check done incorrectly. Here's what most people don't understand. Your monitor isn't the problem. Modern devices are extremely accurate. The problem is technique. Because blood pressure is the most sensitive vital sign in your entire body. It changes with your posture, your breathing, your emotions, your bladder, your arm position, even your clothes. And there are 11 critical mistakes that can completely corrupt your reading. One mistake, and your number is useless. By the end of this video, you'll know all 11, and you'll have a simple step-by-step protocol doctors use in clinics so your home readings are finally accurate. But first, let me tell you about Margaret, because her story reveals mistake number 11. And it's something so innocent, you'd never suspect it. Mistake number 11, measuring right after activity. Margaret was 68, retired teacher, extremely disciplined. Every morning at exactly 7 a.m., she checked her blood pressure. Same chair, same monitor, same routine. For years, her readings were perfect. 125 over 78. Beautiful numbers. Then suddenly, 165 over 95. 170 over 98. 168 over 96. She panicked. She thought she was heading toward a stroke. Her doctor almost doubled her medication. But here's what actually happened. 3 weeks earlier, her daughter encouraged her to move more. So Margaret started walking to the mailbox every morning. Just 2 minutes. Then she walked upstairs, sat down, and immediately took her reading. That tiny walk was enough, because even light activity activates your cardiovascular system. Your heart rate rises, blood vessels constrict, your nervous system switches into active mode. And if you measure, then you're not measuring resting blood pressure, you're measuring active blood pressure, which can be 30, 50 points higher. Margaret's real blood pressure never changed, her timing did. The fix? Simple and non-negotiable. Sit quietly for 5 full minutes before measuring. No walking, no stairs, no chores. But here's the thing. That mistake was accidental. The next one? People make it every day on purpose. Mistake number 10, measuring with a full bladder. This one shocks almost everyone, but it's medically proven. A full bladder can raise your blood pressure 10 to 15 points. Sometimes more. Let me explain. When your bladder is full, pressure builds inside your abdomen. That pressure compresses blood vessels. Your body responds by activating your stress response. Heart rate rises, vessels constrict, blood pressure climbs. Harold, one of my patients, learned this the hard way. Every morning, his numbers suddenly jumped. 150s, 160s. Nothing else changed, except one thing. He started drinking more water at night for hydration, which meant he woke up with a full bladder and measured before going to the bathroom. The moment he emptied his bladder first, back to normal, 130 over 80, completely fixed. So rule number 2, always use the bathroom first, every time, no exceptions. Mistake number 9, talking or moving. Now this one seems obvious, but people underestimate it constantly. I'm just talking calmly. I'm only answering a question. It's not a big deal. It is. Even light conversation changes your physiology. When you talk, chest muscles engage, breathing changes, heart rate increases, nervous system activates. And the cuff? It's trying to detect incredibly subtle pressure changes inside your artery. Tiny signals. Any movement or talking distorts those signals, but here's the dangerous part. The monitor doesn't say error, it gives you a wrong number, usually falsely high. Diane used to measure every evening while chatting with her daughter on the phone. Her readings were always 20 points higher at night. Once she stopped talking, perfectly normal. So this is critical. During measurement, absolute silence, no talking, no texting, no movement. Mistake number 8, wrong arm position. This one is pure physics. Gravity. If your arm is too high, reading too low. If your arm is too low, reading too high. The difference? 10, 15, even 20 points. Thomas learned this after buying 3 broken monitors. At home, 115. In clinic, 140. Turns out, he held his arm in the air while measuring, 6 inches above heart level. Gravity reduced the pressure in his artery. Fake low numbers. The correct setup? Sit with back supported. Feet flat on floor. Arm resting on a table. Cuff exactly at heart level. Arm fully supported and relaxed, not floating, not dangling, not on your lap. Exactly heart level. Now. We've only covered 4 mistakes, and you're already seeing how easy it is to be off by 20, 30, even 50 points. But the next ones? They're even more common, including one mistake that can make your monitor completely useless, even if everything else is perfect. In the next part, I'm going to show you the cuff size mistake that can throw readings off by 40+ points, the timing mistake doctors hate, the logging error that ruins your data, and the psychological trap that secretly spikes your numbers. And we're getting closer to mistake number 1, the one almost everyone makes, the one that changes everything. Let's continue. Now let me show you something that completely shocks most of my patients. Because this next mistake, it has nothing to do with your body, nothing to do with stress, nothing to do with technique. It's the device itself, specifically the cuff. And this one mistake alone can throw your reading off by 30, 40, sometimes even 50 points, which means your monitor becomes completely useless. Mistake number 7, wrong cuff size. Let me tell you about Ruth. Ruth was 69, petite, small frame, thin arms. She'd been treated for high blood pressure for 3 years. Her home readings were always around 155 over 92, 160 over 95. Her doctor kept increasing medications. 1 pill, then 2, then 3. But here's the strange part. She felt worse with every increase. Dizzy, weak, lightheaded, exhausted. Classic symptoms of blood pressure that's too low. But her monitor kept saying it was too high. So everyone trusted the machine. When she came to see me, something didn't feel right. I measured her arm circumference. 9 inches. Then I looked at her cuff. Standard adult size, designed for arms 11 to 14 inches. Way too big. And here's what most people don't know. Cuff size is not about comfort. It's about math and pressure physics. If the cuff is too large, it spreads pressure over too much area. The device has to inflate higher to detect the artery. Result? Falsely high readings. If the cuff is too small, it oversqueezes. Falsely low readings. Both are dangerous. We switched Ruth to a small adult cuff. First reading, 118 over 75. Perfect. She'd been over-medicated for 3 years, all because of the wrong cuff. So here's what you must do today. Measure your upper arm circumference with a tape measure. Check the size range printed on your cuff. Make sure your arm falls inside that range. If not, get the correct size. Otherwise, your numbers mean nothing. Now, this next mistake is sneaky because it doesn't change your numbers by 30 points. It ruins something even worse. It ruins your data. And without good data, your doctor is just guessing. Mistake number 6, measuring at random times. Let me tell you about Franklin. Franklin measured whenever he remembered. Morning, afternoon, night, after lunch, before bed. Totally random. His readings looked like chaos. 115, 145, 160, 130, 150. His doctor couldn't make sense of it. Was his blood pressure uncontrolled? Was the medication failing? Nobody knew. Here's what Franklin didn't understand. Blood pressure isn't static. It follows a daily rhythm. Naturally, lowest during sleep, Spikes in the morning, morning surge, higher midday, lower again at night. This is normal, healthy, expected. So if you measure randomly, you're just capturing different points in that wave. It looks like instability, but it's just biology. Once Franklin switched to same time every morning, same time every evening, suddenly everything stabilized. 125 over 78, 120 over 75, perfect. So rule, measure it the same 2 times every day. Consistency is everything. But here's the problem. Even if you measure perfectly, or if you don't track it properly, your brain will lie to you. Mistake number 5, not keeping a real log. This one drives doctors crazy because patients say things like, it's usually fine, sometimes high, around 130-ish. That's not data, that's guessing. Let me tell you about Sandra. She measured every day for 3 months, but didn't write anything down. At her appointment, she said, I think it's mostly normal. Think? Mostly? That doesn't help anyone. Memory is unreliable. People remember scary numbers. Forget normal ones. Round everything. Or misremember completely. We gave her a simple notebook. Every entry. Date, time, all readings. Notes, stress, poor sleep, forgot medication. Within 2 weeks, we spotted a pattern. Her evenings were always higher, so we adjusted medication timing. Problem solved. But we only solved it because we had real numbers, so this is non-negotiable. Log every reading. Not sometimes. Every time. Now we're moving into something most people never consider. And this one? It's psychological. But it can spike your pressure 20 to 30 points instantly. Mistake number 4, measuring while stressed or anxious. Let me ask you something. Be honest. How many times have you checked your blood pressure? Because you were worried about your blood pressure, exactly. And here's the trap. Anxiety raises blood pressure, so you measure while anxious. You see a high number, you get more anxious. You measure again, it's even higher. And suddenly you think you're dying. Edward did this every morning. He'd turn on the news, watch stressful headlines, then measure. Every day, 155 over 92. High, concerning, medication changes, nothing worked. Then we tried something simple. Measure before turning on the TV. Quiet room, no news, no phone, just sitting calmly. New reading, 128 over 80, 27 points lower. The news wasn't the problem, the stress response was. So rule. Calm environment only. No TV, no phone, no arguments, no stressful thoughts. If you're upset, wait. Measure later. Now we're getting close to the top 3, and these last ones are critical because they directly affect whether you might miss a serious medical problem or catch it early. And the next mistake has literally saved lives in my practice because it revealed hidden strokes waiting to happen. In part 3, I'm going to show you the arm difference that signals blocked arteries, the single reading mistake doctors never trust, and finally, the number 1 error that can add 20-30 points instantly. Even if everything else is perfect, and once you hear it, now we're getting to the mistakes that separate casual measuring from truly safe, reliable monitoring. Because everything we talked about so far, those were technique problems. Annoying, frustrating, but fixable. The next 2 mistakes? These can hide serious danger or create false alarms that change your life for no reason. Let's continue. Mistake number 3 is something almost nobody does. And yet every clinic, every hospital, every cardiology office does it automatically. Checking both arms? Let me tell you about Patricia. Patricia was 73, active, independent, felt fine. She had been checking her blood pressure at home for 5 years, always on her left arm. Every reading looked beautiful. 120 over 75, sometimes even lower. She was proud of those numbers, thought she was doing everything right. Then during a routine visit, a nurse measured both arms. Left arm, 120 over 75. Right arm, 165 over 100. A 45-point difference. That's not normal. That's not random. That's a warning sign. Further testing showed significant narrowing in one of her arteries, something that could have quietly progressed for years without symptoms. If she had continued checking only one arm, she might never have known. Here's what I recommend to everyone. For the first week of monitoring, measure both arms. If one arm is consistently higher by more than 10 points, use that arm from then on, because it reflects the higher pressure your body is actually experiencing. And tell your doctor about the difference. It matters. It gives important information about circulation. Most people never think about this. But sometimes the difference between arms is the first clue that something needs attention. Now let's talk about mistake number 2. And this one frustrates me every single day because it creates fake, high blood pressure diagnoses constantly. Mistake number 2 is taking only one reading, just one. Here's the problem. Blood pressure changes minute to minute. It's not a fixed number. It's more like the ocean. It moves, it fluctuates, it responds to tiny changes in breathing, posture, thoughts. So one single reading, that's just a snapshot. It might not represent reality at all. Let me tell you about Vincent. Vincent was 68. Every morning he took exactly one reading. Some days 125 over 80. Next day 150 over 95. Next day 132 over 82. Complete chaos. He thought something was seriously wrong. His doctor didn't know what to do. So we tried something simple. 3 readings, 2 minutes apart. Same position, same conditions. Here's what happened. First reading, second. Third. By the third reading, his body had fully relaxed. The first one was just tension. The average of the second and third? 128 over 78. Perfectly normal, nothing wrong at all. Now this is the rule I teach every patient. Never trust the first number. Take 3 readings. Wait 1 to 2 minutes between each. Average the last 2. That average is your true blood pressure, not the first spike, not the random number, the average. That's what doctors actually use. And now, we've arrived. Mistake number 1, the most common, the most overlooked, and the one that can instantly change your reading by 20, even 30 points, even if you do everything else perfectly. Are you ready? Mistake number 1 is measuring over clothing or over a rolled up sleeve. I know, it sounds small, almost silly, but it's huge. Let me explain. Let me tell you about Alice. Alice followed every rule perfectly. Same time every day. Rested. Quiet room. Correct arm height. 3 readings. Beautiful logbook. But her numbers at home were always 20 points higher than what we measured in the clinic. It made no sense until I asked her to show me exactly how she did it. She rolled up her sweater sleeve tightly above her arm, then put the cuff on. That rolled fabric, it acted like a tourniquet. It slightly squeezed her arm. It changed the pressure in the artery. So the cuff wasn't measuring normal blood flow anymore. It was measuring compressed blood flow. Result? Falsely high numbers, sometimes dramatically high. Even thin clothing can interfere. A t-shirt, a blouse, a sweater. Fabric dampens the signal. The cuff is trying to detect tiny pressure waves, millimeter differences. Anything between the cuff and your skin blocks accuracy. Sometimes readings go higher, sometimes lower. You never know, which is worse, because you can't trust the number at all. Alice removed the sweater completely, placed the cuff directly on bare skin. New reading? 132 over 78, 23 points lower. For years, she'd worried unnecessarily. For years, she'd taken extra medication she didn't truly need, all because of a sleeve. So here's the rule. Absolute, non-negotiable. Always measure on completely bare skin. Not rolled up, not through fabric. Completely bare arm, every time. If you remember only one thing from this entire video, remember that. Now let me bring everything together for you. Here's the complete simple protocol. Follow this exactly every time, morning and evening. Step 1, use the bathroom first, empty your bladder. Step 2, sit quietly for 5 full minutes. No phone, no TV, no talking, just breathing calmly. Step 3, sit with back supported, feet flat, arm resting on a table at heart level. Step 4, bare skin only, no clothing. Step 5, stay silent and still. Step 6, take 3 readings, 1 to 2 minutes apart. Step 7, average the last 2. Step 8, write everything down. Date, time, all numbers, notes. That's it. Nothing complicated, just consistency. Let me finish with this. Your blood pressure monitor isn't the enemy. It's actually a powerful tool, but only if you use it correctly. Otherwise, it becomes noise, and noise leads to fear, wrong medications, or false reassurance. And you deserve better than that. You deserve numbers you can trust, calm confidence, clear information. So starting tomorrow morning, slow down, follow the protocol, do it properly, and you might be surprised how different your numbers look. If this helped you today, share it with someone you care about, because almost everyone makes at least one of these.